What most people don't realize is that sleep deprivation in the hospital isn't just uncomfortable, it can be dangerous. It can lead to confusion, delirium, psychosis, elevated blood sugar, and extended hospital stay. If you or your loved one is hospitalized, watch until the end and I'll show you exactly what you can do and what you can ask the nursing staff to increase sleep and boost recovery. Now, before we dive into what you can do, let's quickly talk about why hospital sleep is so broken in the first place. There are 4 main reasons patients struggle to get rest in the hospital. First, there are constant interruptions throughout the night. Nurses and staff need to check vitals, give medications, draw labs, reposition the patient, and respond to call lights, often all within a few hours. Second, the lighting environment is not sleep-friendly. Hallway lights, overhead fluorescents, and glowing monitors are rarely turned off even at night, which can interfere with the body's ability to produce melatonin and wind down. Third, hospitals are nosy by nature. Between IV pumps beeping, machines starting up, conversations outside the door, and neighboring patients, it can be hard to find a quiet moment. And finally, there's the emotional and physical toll. Patients are often anxious, in pain, or simply overwhelmed by being in an unfamiliar setting. And all of this makes it incredibly difficult to relax enough for deep sleep. And the result is fragmented and poor quality sleep. That's why I'm sharing the exact steps you can take to protect sleep and support recovery. Number 1 is to simply bring an eye mask. Hospitals rarely go dark. Even dim light can suppress melatonin, your brain's sleep hormone. So simply just bring an eye mask or ask the staff for one and ask them if they can turn off unnecessary lights at night. It'll make a difference. Number 2 is to silence the noise. Alarms, IV pumps, and hallway chatter won't stop, especially overnight. All of that noise can keep the brain alert even when the body is exhausted. And that's why I'm recommending bringing your own soft foam earplugs or using a portable white noise machine. If you're looking for options, I've linked a set of earplugs and a white noise machine in the description. Both are easy to pack and safe for hospital use. And remember, it's absolutely okay to ask the staff to close the door and turn off the light. Now, I believe this is the most effective way to protect sleep at night, and that is to ask the staff for clustered care. That means combining tasks such as turning, giving medications, taking vitals all at once so you can get longer stretches of uninterrupted rest and sleep. It's a simple request and most nurses are happy to do it when it's safe. And in the umbrella of clustering care, I want to give you one more tip, and that is to ask the staff for sleep hygiene. When it is clinically safe to do so, doctors may feel comfortable putting you on sleep hygiene, and that means not getting woken up for medications, vitals, turning, and labs for which they come around 3 to 4 a.m. Number 4, comfort blanket. Hospital rooms are cold, which can make it even more difficult for you to relax. You might be surprised how much a soft and familiar blanket can make you fall asleep faster. It gives a sense of comfort and safety, especially for patients who feel anxious, confused, or just overwhelmed by the hospital environment. Choose something lightweight and easy to fold up, nothing too bulky. I saw this happen to my late grandmother, who was one of the most kind and respectful women I've ever known. During a hospital stay, her body was under a lot of stress and she wasn't able to get proper sleep, and she started showing signs of delirium, confusion, altered mental status, and saying things that didn't make sense. It was heartbreaking to witness, and it taught me just how serious sleep deprivation can be, especially in vulnerable patients. I believe sleep isn't just comfort, it's part of treatment. Whether you are a patient or your family member is, you have the right to ask for a quieter and a safer place to heal. Simple things like an eye mask, a set of earplugs, or a kind request to the nurse can make a world of difference. If this video helped you or someone you care about, please share it, because better sleep leads to better recovery. Thanks for watching and see you in the next video.